currently working in the social care sector, which is mainly private and voluntary. And in this sector, it's a very high female workforce, and also people working with, ethnic minorities. And these workers are often exploited regarding their health and safety on 0-hour contracts or really long shifts mainly, so they won't have the required break that they should have. Health and safety is totally disregarded in this sector. The basic things of having just like your breaks just does not happen at all, and they are bullied as well by threats. So with them being on 0-hour contracts or just being low paid in general, they want overtime, they want extra hours, and if should they fall sick or not be able to pick up those extra hours, they're then bullied and threatened by not being able to pick up future work in the next coming months.
Mainly within all sectors within UNISON, we do have a high proportion of female workers, especially in social care. A lot of workers are female who are low paid and are very vulnerable. We've also come across within care homes our night shift workers, migrant workers of a Filipino background, again who suffer detriment.
They are overworked. They do 12-hour shifts as a minimum. Should they go to hospital with a resident, it can turn into a 16-hour shift. And then they're breaking the law by not allowing them to have the 11-hour break between one shift and the next.
We also do some work within home care, where there's a lot of private companies using workers on 0-hour contracts. Now, we've had members reporting us, telling us stories about when there's issues within the workplace around health and safety, and they report it to the companies are actually ignoring the issues being reported, and then our members are being, again, detrimented in future work. Because of 0-hour contracts, they will no longer get future work. They also, if members go off sick due to picking up bugs, again, due to the working conditions they're having to work in, and they go off sick, this then causes further problems because then they don't get any more hours from those private companies being exploited.
I've been thoroughly shocked by the lack of regard for their health and safety, and I'll give you an example. They're toileting these residents who are incontinent, and they're having to change their the sanitary pads that are on their beds with no gloves. So that is just for me really shocking, and one of the basics that they should be able to be provided with. Something simple as gloves will stop them picking up infections, stop them spreading infections to other people, and it just shows how horrible it is in this workforce to not be provided something as simple as that.